David Freed is the U.S. Attorney for the Middle District of Pennsylvania. Thank you for joining me.
My pleasure. Happy to be here.
Now, whenever crises come up or natural disasters come up, there's always a concern about various types of fraud that people could experience. What is your office seeing?
So, as you say, fraudsters and scammers, they will use situations, various situations as entry points for fraud. We've seen it with things like 9/11. We've seen it with natural disasters, and we're seeing it again with the COVID-19 pandemic. It's an opportunity to exploit situations and to achieve their goal of getting into people's pockets. So what we're seeing are various types of scams and frauds related directly to COVID-19, whether they're related to stimulus payments, whether they're related to cures, vaccines, personal protective equipment, all across the map. Again, the mechanism is to use the fraud to get into people's pockets. The ultimate goal is theft. They're just different ways of committing thefts.
So how are these fraudsters, as you say, approaching people? Are they doing it through email, phone calls? Are there other methods?
Sure, various ways. So we've seen direct mail contact, and that's something that people need to be concerned about, because a lot of what we talk about, especially, and the reason that we reached out so specifically last week to our seniors is that fraudsters think seniors mean money. Seniors tend to have nest eggs, and they want to go after them to get that money. And we spend a lot of time cautioning people about giving out information over the phone or over the internet. We've seen a rise, however, and you've probably gotten these at your house, I certainly have gotten mine, in mailings that look very official, but are not. We can say very clearly, the IRS or the Social Security Administration will not call you, they won't cold call you, they won't cold email you about an issue. They start by mail. So the fraudsters have learned to try to use mail that looks official. So we've seen contact by mail, by phone, and certainly by phishing scams, phishing emails to get people to give personal information out that can then be exploited.
So if somebody calls on the phone, what does it sound like? Have you ever heard one of these phone calls?
I have, in fact, at a recent gathering just before the pandemic, when I spoke to a large group of seniors, I played for them a phone call that I was repeatedly getting, and many folks who are watching or listening have probably gotten it. You get a call saying this is the Social Security Administration or the IRS, and you need to call this number right away. There's been a hold put on your benefits, or you're going to be prosecuted, and you need to call this number right away in order to address this situation. And that's what it sounds like. Sounds very official, sounds a little menacing, frankly, if you're not involved in this world. And the next step is people call in, and often they are directed to provide some sort of personal information, and they do that, and then that's an entry point to identity theft. As it relates to COVID-19, we've seen scams where cold calls or emails go out offering free personal protective equipment, free gloves, free masks, if you respond to this email or if you call us. And that often leads to people giving out perhaps credit card information, Social Security numbers, or Medicare or Medicaid info that can then be exploited.
So do we know who's perpetrating these frauds? Are they individuals? Is it organized crime?
So it seems to be a mix right now. What we've seen recently, and it's difficult to deal with, is that some of these larger credit breaches that have happened, we know that some of that information has been held back. The very sophisticated, organized criminals will hold that information back until something like COVID-19 happens, and then attempt to exploit that information. So you've got large-scale, certainly transnational groups, often based in the former Soviet Union or in certain areas in Africa. And then, of course, you have small-timers, too. We've seen a mix of both as it relates to COVID-19.
Now, what steps has your office taken to to prosecute these types of cases or investigate them?
So numerous cases right now are under investigation. We're working closely with our colleagues in the Eastern and Western District of Pennsylvania, and of course our colleagues across the country. The department has set up a COVID-19 task force being coordinated by my colleague in New Jersey, and there's a single point of contact for fraud referrals, and then they get sent out to the districts for prosecution. We're investigating numerous cases here in the Middle District, and then one of the things that we've tried to do is to increase our outreach, which is it's very helpful to be interviewed in a forum like this, so we can be out there talking about it and try to get the word out. It's very important for people and for me to try to emphasize taking away any sort of stigma that there is to reporting. You know, often people are ashamed or embarrassed and they don't want to report having been taken in. The easiest way to report for us is the National Elder Fraud Hotline. It's 1-833-FRAUD-11 in numbers. That's 1-833-372-8311. And we encourage people to make that report. And to the extent that there's action going on in another jurisdiction, it'll get referred there or get referred to us.
So if people do call that number, what types of information should they be gathering to give?
All the details that they possibly can. If it's a phishing email or a voicemail message, take a screenshot of the email or print it out, save the voice message, write down as many details as you can remember. Because as you might expect, in this realm, sometimes the criminals are ahead of law enforcement in terms of technology. So any little piece of intel is very important. That intel all goes to that single point of contact for COVID fraud, and then the investigators have access to it, and they can put these cases together. You know, it's interesting, if some of the voicemails or text messages that come in, you used to be able to say, well, that's from Europe or that's from some other jurisdiction. Perhaps I won't respond to that. The fraudsters have gone to using numbers that look like local numbers. I live in the 717 area code, and I recently got a text message, and it was from a 717 number, and then I got a call from the same number, but when it popped up, it didn't say Lebanon, Pennsylvania, or New Bloomfield, Pennsylvania. It just said United States, which is a sure sign of a scam. They're just masking numbers to try to make it look like it's somebody local reaching out.
So if people are looking to contact law enforcement about one of these fraud enterprises, how do they know whether to contact, say, a U.S. Attorney's Office versus the State Attorney General?
Either or both. Certainly the State Attorney General's Office does a lot of work in this area. We work very closely with that office. So whether they contact the State AG's office and their robust consumer protection unit, that's great at doing these cases, or they contact the National Hotline or the FBI Hotline or our office, there's so much contact taking place among the law enforcement agencies that we'll get it into the right place as long as they make that contact. They can even start with their local police department or the Pennsylvania State Police, who should be able to refer them to the right place.
Well, David Freed is the U.S. Attorney for the Middle District of Pennsylvania. Thank you for speaking with me.
Thanks for having me.
Dr. Monica Lypson is a professor of medicine at the George Washington University School of Medicine and Health Sciences. Thank you for joining me.
Thank you for having me. It's a pleasure to be with you today.
Now, since the coronavirus hit, there have been many reports indicating that African Americans are disproportionately impacted by the virus. So what are you seeing?
I think that is exactly what we are seeing here in the district in Washington, D.C. It's really important throughout the country that we have a better indication of what this data actually is. It would be ideal if all the states and municipalities report data based on race and ethnicity in regards to coronavirus cases.
So is it, there are many different ways to look at the coronavirus, from things like likelihood to be exposed to it, likelihood to die from it. So is it consistent across all those different things, or is it more in some rather than the others?
I think your question is spot on. I think we know the following. We know that people who do not have an opportunity via their housing situation, be it the work that they do. Frontline service workers have a hard time following the guidelines of social distancing. We find that many minoritized populations tend to fill that job category in terms of frontline workers. That could be service workers in the hospital, it could be service workers in buildings in terms of cleaning staff, et cetera, that there's transit support, that when you are unable to participate in dramatic social distancing, it puts you at risk to contact the virus. So that's one thing that we know and is part of a social structural issue around employment status. Another issue might be housing. So if you are unable to socially distance yourself or isolate yourself within your own house, if someone has coronavirus, you might find that a household is more susceptible to multiple contacts and multiple infections in that household because of that. So that's one piece. So that's in terms of overall, in terms of the ability to contract the virus or be exposed to the virus. I think the other question that you might ask is, why are patients from racial and ethnic minorities now suffering more from the effects of the virus once they get it? There's nothing biologically or different in terms of how the virus becomes a potential infectious entity. We do know that there are more healthcare disparities within these populations where there might be more comorbidities, such as high blood pressure, diabetes, or other comorbidities that lead you to a higher risk of more untoward consequences once you contract the illness.
So we often hear the phrase social determinants of health. Is this the type of thing that you're talking about?
Yes. So it's one of those structural issues that we have found in healthcare is just one piece of a person's health. It only entails about somewhere between 10 and 20% of the interventions we can make on someone's health. Health is often determined by these social determinants, access to employment, access to education, interactions with the justice system, ability to navigate environmental resources. Do you live in a Superfund site or do you not? Those type of things are what we call the social determinants of health. And if you have limited access to any of those things, you are more susceptible to having worse outcomes in terms of health as you go on.
Can you kind of take us through the process and talk about how, say, something like structural racism leads to negative health outcomes?
So if we want to think about policy implications, one of the manifestations of structural racism, let's think about redlining in terms of housing structures. So if you live in a community where zoning laws are such that you allow for fast food restaurants with drive-throughs, where you have high concentration of housing stock that is not spaced by yards, is reliant on government support, that housing becomes a social determinant. And how you have access to that housing. Do you have access to things like mortgages? Do you have access to credit to be able to buy different housing stocks? Those are the structural issues within a platform, often based on race, often historical in format, where we often forget why redlining started in the first place. It was about keeping certain populations away from one another and not allowing communities to integrate. We forget that now that we're 40 years away, but those very fundamental policy decisions lead to what's called structural racism, and it'll manifest itself as you move on in terms of thinking about how this goes on. It manifests itself thinking about how you have access to housing stock and right now and how people live. So I think structural racism in the social determinants is an issue. And then we can talk about structural racism within healthcare itself. Who has access to health insurance? Is health insurance associated with your job? Is health insurance associated once you have access? Do you have enough providers in your neighborhood to be able to go? When you go to healthcare, are there biases already placed in and assumptions made about you when you are trying to traverse the healthcare system? Those are all things that we know from the data that structural racism has a play in how my colleagues might respond to a patient, and if that patient even has access to healthcare.
Now, we are still in the midst of this crisis. Is there anything that we can do immediately to alleviate some of these issues?
So one is the data. I mean, I can't emphasize that enough. I think understanding not all of the data now is being reported by race and ethnicity, I think that is key. And then we have to say how well we report the data. So how is that data even being gathered? Is it patient report? Is it somebody at a check-in desk looking at you and making a determination about your race and ethnicity? So I think one is, can we get the data? Two is, do we understand the implications of the different disease categories? Are we targeting our messages around COVID to highlight how a specific community or a specific group of people can better respond to either their infectious rate, et cetera? So, for instance, sick leave becomes a real issue if you are an essential worker. If you are ill, we want you to stay home. But if the economics are such that you can't afford to do that, or you worry about the loss of your job, that actually has a huge impact about how the disease might tread. So there are things that we need in terms of gathering data, but there's some real public policy issues that we know right away can make a huge impact on decreasing disease transmission. Giving masks out to people who may not be able to afford them or don't have access to even keeping themselves safe. Making sure that those resources are available to everyone in an equitable way.
So we talked about the immediate steps that could be taken, but let's think about the long term. Are there specific policy measures that can be taken over the long term that might address these issues the next time something like this happens?
Yes, I think we should be, and I hope I'm hopeful that this is a new moment, specifically in healthcare, where we actually start to think about this. So one is, how do we get the data, making sure that data is reported based on race and ethnicity is sort of key and critical to how we move forward. Thinking about how we address population problems. So if you want to think about even the aspect of if we know a community is more susceptible to an infectious disease, how are we going to approach that community? It's now that we should start inviting community members in, talking about how to address this. We have to start with relationships to build trust. And this is the time to do it so that the next time something happens, we're not relying on fractured relationships between groups of people.
Well, Dr. Monica Lypson, professor of medicine at the George Washington University School of Medicine and Health Sciences, thank you for talking with me.
Thank you. Appreciate it.
Sarah Townsend is an associate professor of Spanish and Portuguese at Penn State University. Thank you for speaking with me.
Thank you very much for having me.
Now, you and some of your colleagues recently signed an open letter to Penn State President Barron regarding COVID-19 issues. What inspired that letter?
Well, I mean, I think many of us were feeling increasingly uneasy with the fact that Penn State, that the administration seemed to be moving forward on developing plans for the fall and, grappling with the larger issues of the fallout from the pandemic without much input at all from faculty. So it's a very unsettling feeling. So that was the larger issue, I think, of faculty involvement in governance, as it became apparent that faculty would not have much of a say in these issues. There was also, I guess, one of the immediate issues that prompted it was the news that the contracts for fixed-term faculty or non-tenure line faculty had been changed to clarify, as the administration put it, the fact that those contracts could be terminated at any time and that furloughs were possible. So that also seemed like an indication that this kind of austerity discourse was in motion, and that the pandemic could be an occasion for longer range structural changes that would be to the detriment of many faculty.
So for people who may not be familiar with some of the internal governance issues at a university, our faculties usually are represented by some organization, and how does that organization interact then with the administration?
Right. Well, there is a faculty senate, right? And of course, Penn State's a very complex university because it's actually has 24 campuses, right? And unlike some other state systems, it's considered, one university geographically dispersed. Each of the Commonwealth campuses has its own senate, and then there's the overall faculty senate, which meets at UP when, of course, such things are possible. And so there is a faculty senate. I'm on the faculty senate, and I guess that's one of the reasons I felt uneasy, because despite being on the faculty senate, I really had very little info on what was happening with the task forces that the university had created to deal with the pandemic and plans for the fall. We got a brief update at our last meeting in May from President Barron, as we usually do on all important matters. But his update basically, just told us about the formation of these task forces. It wasn't entirely clear who was on them, and there was no actual debate at the meeting. Subsequently, I have learned that a few faculty senate officials are involved in the task forces, but very little information has been dispersed, and there hasn't been a process of active consultation with the Senate as a whole or with the faculty as a whole. So
as planning for possible classes in the fall, whether in the classroom or remote, is going on, what are some of the options that are being considered?
Well, according to the plan that the university put out, I guess, a little bit over a week ago now, they would like the majority of classes to be in person. However, classes over 250 will be online, and even as its details are becoming clearer, being worked out, it's obvious that even in-person classes will have to be in a more hybrid mode, right? So because classrooms aren't large enough to allow for social distancing, perhaps you would have half of the students there on any given day, the other half would be participating via Zoom or remotely, right? And then they would switch off. So even in-person classes aren't going to be entirely in-person for the most part. But for faculty, our big concern is that, this poses all sorts of risks for students, but especially for faculty who tend to be older and therefore at greater risk. And so, many faculty, I would say most faculty, feel very strongly that no one should be forced back into the classroom.
How much autonomy should a professor have in terms of determining whether students should be allowed in a class or whether a class should be, say, fully remote?
Well, our position is that faculty should have complete autonomy in making these decisions, right? And right now, the plan that the administration rolled out is pretty vague. So it's still not clear who is going to be calling the shots. In some departments and colleges, administrators are clearly being more sympathetic to the concerns of faculty. In others, it's been made very clear that unless faculty have some overriding health concern, they will be forced back into the classroom. But it's not clear in any case if the central administration will be making the final determination or who will be making the determination. But our position is that each faculty member should be able to make that decision, because we are the ones who are best positioned to know, first of all, what we need to do for our own health and for the health of our students and the broader community. And also we're in a better position to understand the instructional issues, because it's not just a matter of health, right? There are instructional concerns. So for instance, I teach in Spanish, right? In Spanish and sometimes Portuguese. It's very difficult to see how I would teach in a mask. Right? There's all sorts of empirical evidence that students or anyone who's learning a second language relies a lot on visual cues and, the movement of someone's mouth, right? And so it's really hard to imagine how that would play out in a classroom with students who really, are still learning to speak Spanish. So there's all these kinds of concerns that I think faculty are in the best position to decide on. And I should say, among faculty, there's also sort of a debate among those who think that that actually we should not be returning to the campus at all in the fall, and those who, think it's, the administration has made its decision, but individual faculty should be able to choose. So that's a sort of ongoing debate, even among people who signed the letter. And I should say, I just got out of a mass meeting via Zoom. We sent an invitation to everyone who signed the letter. There's now 1,047 signatures from faculty, and then an additional 400 some from graduate students and others who support the petition. But we've sent an email invitation to everyone, and some almost 500 people, I think, RSVP'd. About 400 showed up. And so we had a mass meeting of 400 people from campuses all across the state, right? Which I think is pretty remarkable and historic, I think, but a good indication that this is of real concern to people.
So if the school does go forward with in-classroom instruction in the fall, is Penn State prepared to provide PPE, personal protective equipment, to faculty and staff and students?
I mean, they have said that they will provide masks. I guess, and they have said that there will be a testing policy, although there will be testing, obviously. But even those details are very fuzzy, and it's unclear whether or not they have the testing capacity to do what they would really need to do. I mean, you have to think about the fact that at University Park, where I teach, there's more than 40,000 students, right? Plus staff and faculty. Statewide, I think there's, almost 100,000 students at Penn State schools. So this is, a huge undertaking, and it's not clear from anything that we've been given that they actually have all their, ducks in a row and have this all figured out. I mean, even at a national level, that's been a huge problem, right?
So as the planning goes forward for the fall, is there thinking about what happens, say, if a class that would normally have full enrollment doesn't have it as a result of remote teaching? Is that affecting decision making?
It's not clear yet what will happen if classes are under-enrolled, and this was a big concern. This is a big concern for non-tenure line faculty, right? Who, especially with this new wording in the contract, can be dismissed at any time. And so one of our demands in the letter was that if classes are under-enrolled, first of all, that might help with the social distancing issue, but even if classes are under-enrolled, no one should be fired, right? You're thinking these are all faculty who put in tons of extra work in the spring and are already having to put in extra work because of the uncertainty of the mode of instruction, if it's going to be in-person, remote, or hybrid. And so they should not be dismissed because of under-enrollment. There are many other tasks at the university that people can do, right? Curriculum design, all sorts of program building, things that need to happen and often don't happen, and this would be an opportunity for those to happen. And Penn State's in a very good financial position, as itself it acknowledges, as the administration acknowledges. So,
does the open letter address any issues relating to graduate students and some of the funding or some of the challenges that they may face?
It does, and that is something that I was very insistent on. As you can imagine, there were 12 of us involved in writing this letter, and then we also consulted with many other people. And so there were, a lot of debates about what should go in the letter, what shouldn't, what its scope should be. And that was one thing that I felt very strongly about. I think by the end, everybody was kind of on board with. The work of graduate students has really been affected. First of all, graduate students, they're also employees. They also work. They do research in labs. They teach. And so, like all the rest of the faculty, their working conditions were very affected with the shift to remote teaching. the libraries are still closed. We don't know when they're going to reopen. Research that graduate students need to do for their dissertation is in many cases impossible because, labs have been closed until recently, or because they can't travel to do archival research or field work. So all the things that are affecting faculty in terms of research are also affecting grad students who have a very limited amount of time. The funding for grad students has been progressively cut over the years. And so, many grad students have, say, 5 years to take a bunch of classes, write a dissertation, get a job. And this pandemic has had a serious effect on that. And so the letter calls for an extension of funding for all graduate students who have been affected by the pandemic, which personally I think is really all of them. But right, that's a very important. It makes no sense for Penn State to be producing graduates who can't get jobs because they've been pushed out too soon, and they had to write a dissertation under really not ideal circumstances.
Well, Sarah Townsend, Associate Professor of Spanish and Portuguese at Penn State University, thank you for joining me.
Thank you.